questions that we've gone through, and then also we'll open up the phone lines as well, just to have people share.
Okay, and we are live.
International Childhood Cancer Day 2022.
Always with the low cholesterol goodness your heart needs to keep the rhythm of the family going. 3 Crowns Milk. Healthy moms, happy families. One expert brings you mega prizes during this soccer tournament.
Your thoughts, your hands. The theme this year, what's
Through
the theme?
your hands.
Through your hands. Through your hands. That's
Your
our
hands.
hands.
Our hands. On
Okay, so the ICCD, that's they are a global collaborative campaign to raise awareness about childhood cancer and expert support. But you are from the Dorcas Cancer Foundation.
Yeah. So it's a pediatric cancer.
Okay.
Yeah.
Okay, so just tell us about yourself and what your foundation does, and then we'll have some questions to follow up with all of that. We're going to open phone lines like Chopper mentioned, so it'll be very interactive and interesting.
What we're gonna do right now is take you way back into time. Way back to timeless music. Let's get it on. With Motown greatest hits from as far back as the 70s. Marvin Gaye, Soulful King, The Temptations, Gloria Gaynor, Gladys Knight, Gladys, sexy. Enjoy the smooth collection and blend of Motown greatest hits on your radio. Motown Monday, every Monday from 11 a.m.
Now,
Pictures and video.
okay.
It's now it's just simple 1, 2, 3, 4.
1, 2, 3, 4. Alright, no problem.
It's not a question of clear signal. It's not a question of quality sounds.
Justin is in there, so
It's
I
never
wasn't
a
able to
question
join.
of an engaging, intelligent discourse.
Democratizing beyond democracy. Eric, between your thoughts. Final third.
In fact, it's never been a question about who stands out in the best radio program.
So raise your glasses, folks. Ladies and gentlemen, this toast goes to Smooth 98.
And can
And it can never be a question about who we are. We are Smooth 98.1.
Mine said that we're doing it.
Okay, so Mr. Corey, awesome. Okay, we're going live, guys. Smooth 98.1, love music, love life. Welcome back. If you just joined us, it's time for Lagos Talks 981, where you, Lagos, get to talk. And today it's a special. And of course, don't forget, Smooth Breakfast is brought to you by Shopper Martins and Kylie Baker. And today we have a very special guest with us in the studio this morning. We're going to be having a conversation in regards with cancer, of course. So we talked about this at the start of the show. Of course, today is the 2022 International Childhood Cancer Day. And of course, the hashtag this year is Through Your Hands. Like I mentioned, we have a very special guest in the studio.
Yes, now joining us for today's Lagos Talks and joining you, because I hope you will join the conversation, we'll give you the numbers, is Korede Akindele, who's the head of programs at the Dorcas Cancer Foundation, which is a non-profit organization that's working very hard to improve pediatric cancer survival in Nigeria through efforts in research, early detection, diagnosis, and treatment. Welcome to the show.
Thank you. Good morning,
Good
Lagos.
morning.
Thank you so much for joining us and for all the work that you do in kind of raising awareness in trying to tackle this thing so that we can get better survival rates
Exactly.
for our children, for the children of the nation.
Exactly.
All
Now
right.
we have a ton of questions that we're going to be asking.
Okay,
you.
no problem. That's fine.
I know you're prepared.
Yeah.
So Lagos, you also can chip in those questions. Send your messages to 0809-444-0981. And also we're using the hashtag Lagos Talks 981 on Twitter. And finally, we're streaming live as well. So use the hashtag, or rather just go to our web YouTube platform. It's youtube.com/smooth 981 FM Lagos.
All right. So first things first, considering the what today is, which is International Childhood Cancer Day. It's a day where we get to raise awareness about what is going on and what is the leading cause of death for children and adolescents around the world. It's unbelievable. Now, the one thing I'd like to ask though is let's center it home,
Okay.
right? What are the statistics for child cancer in Africa and even bringing it more specifically in Nigeria?
Okay. Thank you so much for that question. It's a very very dicey question. Why I say that because
Okay.
it's rather unfortunate that in Nigeria we don't have a statistic for childhood cancer. If
Oh, now that's
yeah,
worrying.
We don't.
and that yeah, if you go online now and say okay, numbers of cases in Nigeria, you would, I mean, what you would found would be, I mean, either other African countries or somewhere else. But and that's what one of the things we are doing at the Dorcas Cancer Foundation, and it's part of our research. And at the Dorcas Cancer Foundation, we have 4 goals that we work with, which we call the REAP goals, and REAP. And everything we do at the Dorcas Cancer Foundation is centered around the R stands for research,
Okay, research.
the E stands for early detection, the A stands for accurate diagnosis, and the P stands for prompt and proper treatment. Now, when we talk about research, and so I'm going to link it up to what the question you asked. We started this research so that at least this research is not just for advanced medicine like in the developed world, but let's start seeing the numbers, and that's why we launched this research grant in 2008.
Okay.
We've done the first in 2008, so we have the second one ongoing now, which we released. So what we're trying to do is let's know these numbers. Yes, some centers has their own personal registries of the cases they've seen, they document it, but it's not on there's no cancer registry for pediatrics. So it's one of the things we are doing now so that we can start seeing these numbers, so that we can start seeing okay what we are seeing in Lagos. Fine, we have quite some people that has come to our organizations and we have been documenting, and so we are gathering the facts, and so it's alarming. The number is increasing.
So
Yes.
far that you've mentioned that the numbers are increasing, they're trying to gather as much data as you can.
Yes.
But then again, it's also important to understand what the causes are. So could you walk us through this for those out there listening? What are the notable causes that could bring about cancer in children, and also the possibilities of this cancer or these cancers now being avoided?
Okay, let me just say, I mean, the possibility of cancer in children, it's quite unfortunate that you cannot pinpoint that this is the cause of cancer in children. It's not like an adult that has, breast cancer, for example, there's a lump. But the good thing is there are warning signs. There are warning signs that you look for as an healthcare officers, healthcare professional. Sorry, that's why part of what we do on early detection.
Which goes, I was about to say
Yeah,
early detection.
and that's what we do on early detection, and we try as much as possible to focus trainings because we believe. I mean, let's look at it from this angle. Why do we start the trainings that we do for early detection? There was a time we were trying to, we treat children with support treatment, but we see most of times when these children come to our platform, this student comes to where we are, the cases are advanced, it's late stage. So what is the problem? And they tell you we've been going to the hospital, we've been treating malaria for 6 months, we've been treating this, and then before someone said, okay, this is cancer. So it's pathetic. So what we try as much as possible to do is, okay, let's start developing these first core health officers, which are community healthcare workers, primary healthcare workers. These are the people, when a child is sick, that's where you take your child to. So these are the people we focus the early detection training on, to train them on the possible signs. We are not training them to treat.
Okay.
But just to
to
detect.
To detect and to look at, okay, if you see this thing, please refer the child to a tertiary institution. Now, it does not say if you see this thing, this child has cancer.
Okay.
It's just referred.
It's just
to someone
referred,
who can
and we've
diagnose.
seen the result of this. That even most times when these children are referred, it might not be cancer, but we've saved the child from another illness because he's seen a specialist that can easily diagnose and say, you know what, this is the problem with this child. And so that training is focused on community healthcare workers. We are being careful not to just say, okay, to just, so that someone will not see a
Not to
child on the street,
generalize it.
generalize, see a child on the street and say, wow, this child, it's cancer. So
Now, but what about for, because yes, you're looking at these healthcare workers, but what about for parents who might just brush something aside and say, oh, it's just a bump,
Okay.
maybe they fell or something, I don't know. So what would you say that they could be on the watch out with regards to early symptoms?
okay, for parents, we tell parents it's so important. Please pay attention to your child. Every parent knows his or her child very well. You know this child is an active child, and suddenly it's getting cold. You know this child, there's a repeated illness, especially, for example, let's talk about one of the type of childhood cancer, which is leukemia. There are different type of childhood cancer, which is different from adult cancer. We have leukemia, we have brain cancer, we have lymphoma, we have retinoblastoma, that's the cancer of the eye. We have the cancer of the kidney, which is Wilms tumor or nephroblastoma. Those are the common cancers we see in children. And so, for example, let's look at the retinoblastoma, the cancer of the eye. If this room get dark, normally the eyes should be normal, but if the room get dark and you see something like a cat's eye, something flashing in the eyes of the child, then there's something that say, you know
Refer
what,
to a health worker.
let's quickly see. And we have a case like that. He is a survivor today. His name is Perfect, a very fantastic guy. I call him Perfect, that is still perfect. It occurs that he was doing an assignment with his mother, and then the light went off, and
They noticed
She
it.
they
noticed
noticed that
something.
something is not doing well, and they take to the hospital and say this is cancer. And that was like today. Perfect is
So
fine.
that was the case of early
That was the
detection.
case of early detection. So that was the part of the parent to pay attention. So if you're going to an hospital, your child is sick, repeated illness, and they say, okay, it's malaria, it's
Or treating
typhoid, they're
different
treating
things and not
different things.
understanding what it is.
For example, leukemia comes along with infections,
Okay.
infections that is not going.
Okay.
So if there's an infection that is not going, please ask your doctor, can you
To
refer me? And most times they say, okay, let's continue. No, don't continue. Let's just be sure that this is not what we are thinking. So,
All right. If you're out there and you're listening to the show, you want to be a part of our conversation this morning, well, you can. You can call us. We'd like to hear your thoughts. Call the number 0144899981. Today we have with us in the studio Korede Akindele. He's the head of programs at Dorcas Cancer Foundation. And we're having a conversation about, generally about cancer, really, but it is the 2022 International Childhood Cancer Day, and of course our focus is on childhood cancer this morning. So if you've got questions, like I mentioned, you can also send them to our WhatsApp platform, which is 0809-444-0981. Now, Mr. Korede, so you talked about, signs, symptoms, early detection. You also talked about the fact that we need to train more personnel, right?
yeah.
But then again, what should be the next signs for early detection, outside the fact that parents should get involved, and also there should be referrals from hospitals as well? Okay. What else should people look out for, like parents out there look out for?
Okay, I will start by saying that when a child is sick, a child is sick. A child will never pretend. And adults, me and you, I mean, if I have a headache when I'm coming here, I can pretend immediately I got into this place and say, no, well, let's do what we want to do. I can ignore my symptoms. It can be like that for 6 months.
Okay.
So, but for a child, when a child is sick, it tells you, mommy, headache, mommy, this place. So as a parent, it is important to please pay attention to your child. check through your child's body. If you notice now, if you notice a growth that is abnormal, if you notice a child falls down, normally it should stand up, but you just found that on the bruise is it just become bruise and then it's not going. It's a sign that something should be seen. Repeated infections, for example, it's a sign that okay, there's a problem. A high like a cat high. So those are the little things. But the most important thing we tell parents is please, the health of your child is important. We don't want a parent to say, okay, because they said, okay, this child has bruises. No, 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 no. You know your child. This child is getting healed. There is a strange growth around his body. Take the child to a specialist. And if a child is brought to either a primary health center or an hospital around, the healthcare professionals, the healthcare workers should please, you've tried what you need to do, but this child keep coming in every month, every time, and then please do refer. And that's why I will link it up to what the theme of this month is. Through her hands, better survivor is achievable. Through her hands, everybody is achievable. Fine, we can the cancer, the pediatricians, the pediatric oncologists,
Okay.
they can do their job. But for us to make their job easy, it has to start from the grassroots. So the person that should actually see a child is a pediatrician.
Okay.
And that pediatrician, if he sees that something is wrong, he runs the test, and if he detects something like this, like cancer, he refer to a child to a pediatric oncologist.
Just to put a pause in your thoughts right there, we see the phone lines buzzing. We're going to attend to them just after the break. Don't forget, this is Smooth 98.1. Lagos Talks 981 is what you're listening to. We're back after the short breather.
Hope we're having this conversation.
Good. You're doing well, very well.
Oh, it's so easy to learn anything today. That's how my little niece of yesterday typed my gele for me like a pro. When I asked her who taught her, she just gave me her phone to watch a video. Now I can tie my own gele. Plus, I'm also learning how to prepare fisherman soup.
Okay, so you now touched on the next line of action, which is us. So parents, that can parents request that their child be that their child's case be forwarded to a pediatric oncologist, or do they have to? Because
No,
if they wait for the pediatric.
A parent cannot, because your child is sick, you can't say, okay, you want to see a pediatric oncologist. That's why when a child is sick, it's good to take the child to a child's doctor who is a pediatrician.
Now, if we've had so many cases of, which I guess is where your training comes in, but like if a parent has heard this and said, okay, so I'm seeing this cat's eye, I'm seeing easily bruised, I'm seeing child with constant infections, and they keep giving me malaria and typhoid diagnosis.
So go to a specialist, a tertiary hospital, a teaching hospital.
Okay, so I'm gonna ask you that on air.
Just go to it. You can, because for example, because at the end they will be referred there after they've done what they need to do. I was having a conversation with one of our doctors, and it was showing me it was even a breast cancer and adult cancer. And this doctor does not have anything to do with breast or something. His job is not that. But he's been managing this woman, and then when it has now get out of hand, now refer to an almighty oncologist that will now do magic. So if anything happens, they put the blame on that uncle and that center, like, oh, this.
Well, I said this one is stage 5.
This
Now,
one is
what are we
stage
supposed to do?
5.
To enjoy 24/7 dedicated care lines. Contact Airtel Business at ng.airtel.com.
To teaching hospital.
Teaching hospitals that has dedicated pediatric oncology centers. And the place is for Lagos is Lutz.
Okay.
Yeah.
I think that's the only one we really have.
That's the only one in there. Lutz.
We're going back. Smooth 90.1, love music, love life. It's 8:29 by our time. If you just joined us, Lagos Talks 981 still is what you're listening to. And we have a very special guest with us in the studio this morning. Of course, in person of Korede Akindele, who's the head of programs of the Dorcas Cancer Foundation. We're talking all about child cancer. And more importantly, we're talking about achieving a better survival rate. So if you're out there and you want to be a part of our talk, please call the number 0144
Hello, good morning. Good morning. What's your name and your location? Okay, Yemi from Amole. Go ahead, tell us your thoughts. If you have any questions, ask away. Okay. Mm-hmm.
Okay.
Mm-hmm.
Okay. Okay. Okay, thank you so much. And I'm sorry about the child. So you know what? I'm so glad that you've been able to take the child to the hospital. I'm very glad. I'm very glad. And please, I would like to say, please, most times don't let us take chances um, for that. So you've taken the child to the hospital, and the doctor has conducted tests. Please, um, the child should be seen. I'm sure the child is being seen by a pediatrician, a doctor that treats children. I'm very sure about that. That should, if that is it. So
Is he,
is
hello?
the child being seen by a pediatrician, a child's doctor?
Correct.
The whole team. Okay, okay, definitely. Okay,
Okay, great.
that's good. And then is in a good hand. Just ask them to do comprehensive check. They should not just do one side check. They should do a comprehensive CT scan, ask for scans, ask for proper check-ins, and let them look at all possible chances. Because I mean 45 is very high, and then it's very very high, and I mean and scary, you understand, and then showing up and showing up. So please tell them to do comprehensive check, and then let them know what this. If they didn't bring out something, please ask them to refer you to a teaching hospital where further checks can be done. Thank you.
All right. Thank you, Yami.
Okay, 01448991. If you got more questions like Amy, you can call that number to be a part of our conversation this morning. Okay, so Corey, we're still talking all about, child cancer basically and achieving a better survival rate. So, what else can you tell us? What else should we be aware of?
Yes, that one question that I asked you off air, I'd actually want to love to bring it up on air, which is kind of that next line of action, because we've talked all about early detection, right? And it's part of
Yeah,
research, early
very
detection,
research,
accurate diagnosis,
diagnosis.
prompt and proper treatment. Exactly. So what can a parent do? Because now you've armed them with this information, but let's say, so for example, you've armed the parents with this information, but they've gone to the hospital and they keep coming back with them, for example, malaria and typhoid diagnosis again and again and again. What can they do, especially if they can't request a pediatric oncologist, or can they?
Okay, fine. If you've done like you said, you've taken the child to the hospital, everything is still the thing. I mean, it's the sickness kept coming. So what I would advise is, like I said earlier on to the caller, a child that is sick should be seen by a pediatrician. Because most times we generalize this thing, okay, my child is sick, okay, I'm a GP, a general practitioner, I just check and then the child is fine. Please, any child is sick, let a specialist that is in charge of child treatment check the child, recommend every necessary thing. So if this person does his job, he or she would know that, okay, there is a problem somewhere, and he would then refer. So if there is chances that, okay, there is delay here and you're still not getting result as a parent, you have the right to ask your doctor, please, can you refer me to a teaching hospital?
Okay.
Can you refer me to a teaching hospital? Can you refer me to a more, bigger setting than these that we are, where we can know what exactly is the problem of the child? You have the right on your child. A child is not getting better, please refer me. I mean, you can't just say, okay, if it's not getting better, you can't tag it as cancer. And like I said at the beginning, that one of our trainings, that which is the community health care workers, we are not training them to say, you know what, this is cancer. But when you see these signs, please refer this child. And like I said, we've done this and we've seen that we've even saved more child from other illness,
Yes.
apart from even cancer.
Because while distressing, it can be a sign. It could be a sign of cancer, but then again, it could be a sign of something
else. Yes.
Let's see what this caller has to say. Hello, good morning.
Good morning. What's your name and your location? Okay, Isaac from Isola, go ahead with your questions or comments. Okay. All right then, Isaac. Thank you so much for your call. So Isaac chiming in, although that did seem to be a bit of a generalized statement, but Isaac saying that bringing up an issue of looking at private medical institutions and the profitization of healthcare, which he says could be one of the facets of not being getting that referral. But yes, we move on. Thank you, Isaac, for your call and for your comments. All right, so now I'd like to give a little bit of background because we actually have a national cancer control plan, right? So the years being 2018 to 2022. Currently, I see your face, I see your smile. I'll be asking you your thoughts on this. But back in 2018, Nigeria launched a $250 million national cancer control plan, which was supposed to take effect from 2018 to 2022. And it was launched with the goal of reducing the prevalence of cancer and cancer mortality rates. And it was also supposed to serve as this launch pad to reduce cancer across the country and also to increase the number of cancer care centers, comprehensive cancer care centers in the country, which would then offer radiotherapy as part of treatment for patients. So we're in 2022. This is the final year. Corridor, what would you say? I mean, give us a review, your thoughts of the cancer control plan.
Okay, thank you so much for the question. Well, it's a very laudable initiative, and then we're glad. I mean, I think I was there when it was launched in 2018, and then We are all glad, we are all happy. But it's so sad that pediatric cancer was not included then in 2018 to 2022. But it's changing now. I mean, it's changing. The next one is being worked on,
Okay.
and then pediatric cancer will definitely be included because from even our end, we have people that work with us that are also part of the committees. Which to the next one, and they are pediatricians and they are pediatric oncologists. So we are so glad that in the next one we hope.
They're at the forefront and they can also, make a case for it.
Yes, definitely they are making a case for it, and I mean we're going to be having an event this afternoon, so it's part of what will also be discussed.
Okay.
There, so they are making case for it. There is discussion going on around it. Then we were it was like, wow, will this thing happen? But now we look it's looking like it's going to happen in the coming one. And I was sharing, there was a dedicated fund for indigenous cancer patients.
Okay.
Yeah, in Nigeria. Yes, breast cancers, cervical cancers, and like 5 cancers like that. The federal government, dedicated some funds for indigenous patients to be able to do. Though pediatric cancer was not there, and it will look like. But like I said, as the conversation towards pediatric cancer being included in the cancer control program is ongoing, there's discussion on it, there's improvement on it. So we believe that in the coming year, the next plan, it will definitely be involved, and pediatric cancers will gain national priority.
Thank you so much for that. I'll tell you what we should do. Let's go on a quick break. When we get back, we'll do some more talking. It'll be the final stretch for us here on Lagos Talks 91. So please stay with us.
It was very, very painful.
Why didn't he?
It was painful then in 2018 because it was not there.
But had you, you knew it was coming about beforehand, yes?
No, we knew, it was just, the way things work in this country. It was just some people call themselves and then they just put it together then, and nothing happened towards it in pediatric cancer. But and the fortunate one was this indigenous fund. It was 5 cancer: breast cancer, cervical cancer, prostate cancer, colon, and all that. But I was surprised that pediatric cancer.
This is all adults,
which is all adults. So it's just that in Nigeria here, maybe we don't have more information, or maybe someone was not telling someone something. But attention is, it's different now. Like 6 years ago, that when we started,
what happened in the interim? You guys were campaigning hard?
We were. To everyone, every corner, everybody actually. I become a pain in their
in their rare end.
In their hands, like this guy. Okay, we will do something about pediatric cancer.
Nice.
But and the good thing is, pediatric cancer is easily treated and children can survive it. In the developed world, the survival rate is like 80%.
Oh well.
Right? But here we are still struggling with 20.
So with like reoccurrence rates?
Yes, but that is what they are now discussing now.
Okay.
They are not discussing survival.
Okay, they are now discussing
they are now
the
discussing
next.
the
So
next
yeah, like let's just get to survival, then we can.
Yes, this child, we know when we handle you will survive. So what
are
the
the
after
steps to
survival,
keep this
how should we
person
save him
alive?
so that there won't be recurrence? So here we are still struggling with early detection.
20 to 30%.
Yeah.
Wow, that's low.
Very, very low. And there are many factors around it. It's not just one factor. There's funding, there is access to treatment.
Smooth 98.1. It is the final few minutes of Lagos Talks as we, for International Childhood Cancer Day, take a look at, shine the spotlight on, focus on childhood cancer in Nigeria. Joining Kaide Baker and myself, Shokwe Martins, in the studio is Korede Akindele, who's the head of programs at the Dorcas Cancer Foundation, which is a non-profit organization that is doing its best work trying to improve pediatric cancer survival in Nigeria. And that's what we're talking about, how we can achieve this better survival rate,
Yes,
right,
exactly.
Korede? So before the break, we were asking about the National Cancer Control Plan, and you told us a little bit about the second phase, which will now focus or
Will
feature
feature
pediatric
cancer.
cancer care as
Yeah.
well. So, okay, that's good. So we're seeing strides being made.
Yeah.
Good work, good work. I like this.
Yeah.
All right, now let's get down to the really personal things now. So I say when we talk about childhood cancer, maybe people are looking at older children, adolescents, but what would you say is the youngest child that you've seen living with cancer at the Dorcas Foundation?
Okay, I've seen 1 year.
Wow.
Yeah, I've seen 1 year. I've seen six. I've seen 6 months. I've seen 1 year. I've seen 2 years.
How? I don't even know how that happens.
I've seen. I mean, there are risk factors to it, but no, it has not been linked to a particular cause. It cannot be. Though they say okay, there's genetics or whatever, but I mean, childhood cancer has not been linked. It's not like adult cancer that you say, you know what, it's because you're smoking. It's because you're no. Childhood cancer has not been linked with a particular cause.
I'm wondering
and
now
so
if we're
it's
going to go into environmental factors.
yeah,
At this point.
no, you can't just link it to it. It has not been.
No. I'm not saying we will just link it like that, but whether studies are going to start.
Yeah, maybe. But like I said, the good thing is early detection of it helps a lot because children has a better prognosis if it is early detected and properly treated. Because one thing is early detection, and that's what the WIP does. If it is detected early, accurate diagnosis. Okay, this child, this is the type of cancer this child has. And it's not that we are doing back and forth and trying to say, for example, like leukemia. I mean, there are different type of leukemia, and so we're trying to detect, okay, which particular one does this child has, and the testing, the payment for the testing, it's quite expensive. Sometimes they need to take the biopsy and send it outside Nigeria to be able to detect what exactly is this.
So that treatment can then be targeted.
The treatment can be targeted. Okay. So it's quite expensive. So accurate diagnosis, when these are done, the child will survive. I share the story of Perfect. I mean, we have other children. We have quite some survivors, and they are doing fine. We are, in fact, even before coming into the studio, I was having a conversation with one adult survivor, and I think she has already been on this show before.
Okay.
Yeah. So been in Smooth FM before.
Wonderful.
Adult survivor.
Glad to hear those stories and
so
be able to share those stories.
And she's doing fine. She's doing fine.
Now, the question I want to ask you is, as you've talked about all that goes on and all that we can do, is these children that you talk about, and I see you really just invested in their health and their well-being and their future, which is fantastic. So what role does the Dorcas Foundation play in when it comes to the battle with cancer?
Okay, at the Dorcas Cancer Foundation, for the children, the role we play is funding their treatment.
Okay.
From the least to the highest.
Wow, okay.
And that's why we have a program that we call the Pediatric Cancer Access Program, PCAP.
Okay.
Pediatric Cancer Access Program. Now, Cancer Access Program. The reason why we put this program together is to create an uninterrupted access to treatment for these children. And so far, since inception, we've been able to treat support over 60 children, and which is quite some good money.
Wow.
So the Pediatric Cancer Access Program is put together to allow individuals, to allow corporate organizations to support this children treatment, even without getting involved with us.
From the least to the highest, but and you say 60 children.
Yeah. So when I say from the least to the highest, that means from their ward admission, okay, to their blood transfusion, to their radiotherapy, to their chemotherapy.
How much does all
every
this cost?
everything about the child. So, for
Oh.
example, let's say a 3 million. Let's just say
Roughly
to
Ballpark.
roughly
Okay.
to just start with a 3 million naira, on to take a child from the start to the end. Let's just say roughly. Not talking of other little expenses. So, and that's what we do. And so when we take, that's why when we take a child, and funding is we want to do more,
Okay.
but we cannot, because if our waiting list is long.
Wow.
And what we try as much as possible to do is to see what we can do. If we look at prognosis and we take these, okay, this child has good prognosis, we try and focus on others. We try to give them, okay, the support through our consumable drives, where the little things they might need. So to the cancer access program, it's what individual can get into, get partner with organizations. So the way this work is, there is a dedicated pool of account that individual can actually put funds to, and it goes directly to the vendors that supply these drugs to the children, to the radiotherapy centers that give radiotherapy. So we don't have anything to do, but we just want to know the track, and so that we can know this. So that's what we do. We fund treatment for children.
All right. Now, I know that you talked about funding and organizations, but also individuals. Where can people go to learn more about the Dorcas Foundation, what you do, how they can help as well?
Yeah, you can just go to our website, www.tdcf.ng.
TDCF.
tdcf.ng.
Okay, so
And
people,
we
I'm going
are-
to go Army alphabet for you. So that's Tango Delta Charlie Foxtrot .ng.
NG, yes. And
Okay.
we're on social media, the Dorcas Cancer Foundation on Instagram, the Dorcas Cancer Foundation on LinkedIn, the Dorcas Cancer Foundation on Facebook, and on Twitter, Dorcas Foundation.
Okay,
Alright.
so basically it's for people to just do a search. The
That's-
Dorcas
The
Cancer
Dorcas Cancer
Foundation.
Foundation,
Okay.
and that's it, all in
Okay.
one word. Thank you so much. It's been a pleasure having you here, having
Thank you
this
so much.
conversation. If you've been listening to the conversation, we've had Korede Akindele, Head of Programs, Dorcas Cancer Foundation. And our topic today on Lagos Talks 91 special is child cancer, achieving a better survival rate. And I do hope that we've learned a few more things about, child cancer, amongst other things. Thank you once again, Mr. Korede.
Thank you so much.
Lagos, there's more to come. In a few more minutes, it'll be time for Lagos Talks 91. But of course, this segment of the Lagos Talks 91 comes to an end. Of course, in a few more minutes, like I mentioned, it'll be time for Grapevine right here on Smooth Breakfast.
Thank you so very much.
Great show, great show.